Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Also, if you're watching us on cable, you can continue to stay up to date with our on-screen social media feeds, providing the latest COVID-19 and community updates and important headlines. The coronavirus is killing Black and Latinos in New York City at twice the rate, according to recent city preliminary data. Mayor Bill de Blasio stated that the disparity reflected long-standing and persistent economic inequalities and differences in access to healthcare. Here to discuss the impact of COVID-19 has had on minorities and underserved communities are two nurses, Shondra Brown and Janet Hill of Black Nurses Corner. Thank you, ladies, for joining us.
Thank you for having us.
To start, can we just learn a little bit about yourselves and your backgrounds in healthcare?
I am a nurse practitioner. I have over 20 years of experience in the health field. And currently my role is as a clinical nurse expert, where I educate nurses on a particular unit. I get them up to speed. I help them prep and kind of be a resource for them.
I have been a nurse since 1996. I actually started off as an LPN, took my boards for my RN license, worked in med-surg for a year, occupational health, the fire department, MTA. Then I settled on my specialty, OBGYN. I've been doing that for a number of years, antepartum, postpartum, labor delivery, float to NICU. Right now, I'm in the ambulatory care setting, OBGYN at Emory University Hospital.
So, ladies, I stumbled upon your page on Instagram, Black Nurses Corner, and I saw this post that really struck me. It was about environmental and systemic issues lined up with the high rate of COVID-19 deaths in communities of color. So if both of you want to speak about it a little more, just about how COVID-19 has impacted underserved and Black and Brown communities, just a little bit of background on that.
The point of it all is that we need more Black and Brown faces in healthcare, because when we present with symptoms, oftentimes providers downplay our symptoms. They don't listen. They tend to kind of have this kind of like just nonchalant attitude about what's occurring in front of them. They tend to forget the fact that people have asthma. People may be living in industrialized areas. They forget that nutrition is sometimes minimal in Black and Brown communities, not because we don't eat, but because there's food deserts. So if you don't have say a grocery store within, say, a 15-minute walk of your home, you're catching public transportation, therefore exposing yourself to possible virus. You are going into supermarkets, you're touching, handling, and then all of a sudden you have to carry these items either back on the bus or you're Ubering, and there's no telling who's in the Uber before you, if they've cleaned it. So it's kind of like a trickle-down effect, and it really does start with not only the environment that you live in, it starts also with the hospital that you present these symptoms with. Are they listening? Are they taking you seriously? So when that happens to us, it kind of like puts us on the back burner. They're not taking us seriously. So that's kind of like just a small nuance of what COVID is to our communities, but it's so deep. I can't even just begin to get into it because we would be here for hours.
Right. Just to piggyback on what Shondra said, I mean, there's definitely implicit bias in the healthcare field. I know there was a study done where medical students of today, like 2020, they believe that Black people don't perceive pain as like a white person would, or a person of another ethnicity. They don't take us seriously. As Chandra was saying, if we had more people of color in the healthcare field, I think our concerns will be taken seriously. Even with COVID-19, it's hard for us to get testing. We complain of shortness of breath. They say, you know what, just wait, quarantine for 14 days. And when you finally come into the hospital, you're being placed on a vent. So I think that's another issue, implicit bias.
And what are some of those challenges that nurses are facing now, especially nurses of color in the field during COVID-19, that you can both speak about?
From my experience, our nurses, we tend to kind of want to live close to where we work. especially not just nurses, but just people in general. You want to live close to where you work. So if you live close to where you work, that means that maybe you have a 10-minute ride to get to work. You go to work, you expose yourself, you come home, you are living in a community of your choice, obviously, but we tend to live where we're comfortable, which may be around people like us. So not only are you exposing yourself, you're going home, you're exposing your family members, you're exposing your neighbors, because you have to go to the store, you have to get gas, you have to get your necessities, you still have to pay your bills. So for us, we tend to just put our heads down and we kind of grind it out. We kind of just do it. It's expected. We're workers. So if you have that work ethic mentality, you tend to ignore yourself. You ignore your symptoms. And then all of a sudden you come home and you can't breathe the next day.
Right. And I read somewhere that more than 30% of Hispanic and Black people are actually in the healthcare system. Like they're the ones working as essential workers in healthcare.
Right.
So on top of that,
Right.
you're going into the forefront of this pandemic, and you're also the top twice as most likely to die from this pandemic. Isn't that incredible?
Yeah.
Janet?
Yes, I mean that's so true. Like you look at the essential workers, the mailmen, the mail women, Amazon drivers, nurses, housekeeping, people like that. My son, he works at Home Depot. He's putting his life on the line going in, and he's an essential worker. So the majority of us, Black, brown, we are performing these roles, and we're putting ourselves at risk. And another thing I like to say is, we need access to proper PPE, whether it's the grocery store clerk, the nurse, the janitor, the housekeeper, we need proper equipment to do our job.
I wanted to ask you, ladies, what type of things you advocate for on Black Nurses Corner and why? And, what made you want to start this page, this initiative on social media?
I'll let Janet answer that.
Well, my friend Shondra, we see eye to eye in a lot of issues. And it was actually her idea to start this Black Nurses Corner. She asked me to be a part of it. And I have to tell you, I had feelings of trepidation. I'm social, but not that social, kind of laid back. And I knew that this would be putting ourselves out there. But when I looked at the numbers, the health disparities, the poor communities, how could I not do it? We want to make sure we empower our viewers, our followers to advocate for their own health issues. If that's saying, you know what, doc, I really am sick and you're going to see me today. Or, my mother's sick, my grandmother's sick. We want to empower our followers. We want to move towards health equity, not just health quality or equality, health equity. So this is what we're doing.
And I know it's hard nowadays for people to chuckle a little bit because of what's going on, but you both use humor in order to pull that message forward. And I really love that and enjoy that about your posts. So thank you for doing that.
Oh, you're welcome.
I'm glad you get out humor.
I wanted to ask you, ladies, if you both can propose something that can slow down the rates of things like COVID-19 from affecting Hispanic and Black people at these fast rates, what would that be? What would you propose can help this growing rate of dying people of color?
Well, this is one thing that I find very interesting. With all of the talent, all of the entertainment that comes from New York City, I see that there has been things that was done for communities of, say, like healthcare. What I would like to see is some of the big names in New York City to start passing out PPE, use their voices to get people masks, to get people proper gowns and get them gloves on their jobs. You have essential workers who look like us, who essentially need to be protected, who also need to be heard. They should also have the opportunity to shop when they need to have access to fresh fruits, to have access to vitamins. I want to see people kind of empower our essential workers to not only go to work, but also balance and be able to take care of themselves after work. So part of that is having the proper equipment, like Janet mentioned earlier.
So the heroes that we all praise and applaud are not feeling protected still, even through this entire pandemic. And how do you feel about that? Just being called the healthcare hero and a person on the front lines, but you don't feel that in your heart, right?
Right. You know what it is? We feel like we're doing our jobs. This is what we want to do. We need what we need to do our jobs. Do I feel that we get the necessary, not praise, but just acknowledgement? Like, you know what? You're showing up. You're here. You're taking care of this person with COVID. I'm OBGYN. We may have a new OB come in. The mother is concerned about COVID. I just think that we need to just be more out there. I just came across an article on my Nurses Economy magazine where it said, are nurses going to be the new face in social media, TV, things like that? And I believe that we should be, to get our message out there. Like, we're nurses, but we are a part of a bigger healthcare system. So I just think that we need to have our message brought to the forefront.
And I don't necessarily think that we're heroes. I think what they see us do now in times of crisis, we've always been this person. It may not have been to this magnitude, but we've always been healthcare givers. We've also been healthcare providers. We have lives, we have families, we have loved ones. And when they call us heroes, I'm like, we're not heroes. We're doing our job. This is our job. This is what we were, quote unquote, called to do. This is what we were supposed to do. So I don't necessarily think we're heroes. I think I love nursing. I love people. And most importantly, I love us. And I want us to come out of this with a sense of knowing, with a sense of empowerment, and with the foundation to say, you know what, not on my watch. This will not happen again. And I will advocate for better access, advocate for our healthcare providers to listen to us. So I don't want it to be as if we're heroes. I want it to be as if we're educating and we're empowering.
Shondra, Janet, thank you so much for your time today. I know you both work hard and you dedicate a little bit of time for us today. So thank you.
Oh, you're welcome. Anytime. Yes.
Thank you for having us. I appreciate it.
Pleasure speaking to you both, and thank you for sharing this wealth of knowledge. Everybody, please go follow Black Nurses Corner on Instagram and stay connected with Shondra and Janet. Please stay tuned. BXRx will be right back.